Hello, everyone. Thank you so much for joining me today. Hello, my name remains Labake, also known as Elizabeth. Thank you so much for joining me today on the 29th edition of Your Health Matters program. I really appreciate all my viewers today. Thank you so much. I appreciate you, I acknowledge you. Just to let you know, I have a special person on today's program in the person of a doctor actually in the forensic. He has a lot of experience. Please welcome with me today, Dr. Ajileye. You're welcome on the program today.
Thank you very much for having me, Labake, on your program. It's such a wonderful opportunity to be able to share my knowledge and experience with our viewers today, and I hope we'll have a wonderful time. Thank you.
Thank you. Can you please introduce yourself in terms of your clinical background, where you've worked, so that people can know who they're talking to?
Okay, thank you. My name is Dr. Ajileye. As I said, I trained as a psychiatrist, and I've been in psychiatric field in the last 17 years working in the NHS. And that means I've worked across different jurisdictions and NHS hospitals. I'm currently working with Birmingham and Solihull Mental Health Trust as a consultant psychiatrist. And I specialize in general adult psychiatry, basically. Also have special interest in, other aspects of psychiatry, like old age psychiatry and addiction psychiatry. So I do that. In addition to my work as a psychiatrist, I'm also a forensic physician, independent forensic medical examiner with the police. That means I work across different police constabularies and forces in the United Kingdom. I have worked with the West Midland Police, Gloucestershire Constabulary. I've worked with the Nottinghamshire Constabulary, West Mercia Police Constabulary, Staffordshire Police Constabulary. So I have extensive experience, working within the field of forensic. And, I'm also the chief executive officer of Pivot Medical Services, which is an organization that is set up to provide, medical services across different range of, medical expertise, including biomedical sciences as well. And mainly I work in the United Kingdom, but part of my work also include, having to provide, consultancy services to Nigeria, to Africa, to Ghana, to different other people who need my expertise in different areas. At the moment also, I'm also a visiting consultant psychiatrist to Majesty Prison, where I provide, intervention and mental health for secured care patients within the prison population. In a nutshell, basically that's what I'm doing. I have various other things I do, but let's limit that to my clinical role for now, because I'm also an health insurance consultant, and sometimes I do consult for the Nigerian government in the aspect of health insurance development and policy development. Thank you.
Thank you so much. So the reason why I actually want Dr. Ajileye to actually talk a bit about his background is for you to be able to understand that, look, he's got these varieties of knowledge. And is actually, we are really honored to have you today. Thank you so much for joining us. Last Health Matters program, when we were actually talking about anger management, somebody called in and actually asked a question, and the psychologist couldn't answer the question. So I said, okay, you know what? We'll bring somebody who's got experience, who is a psychiatric, who is a doctor in the forensic setting. So that's why we have Dr. Ajileye. Thank you once again for joining us on today's program. And before we go into today's program, I would like to make this announcement. You can watch your Health Matters program on Ben TV, Sky Channel 458, on every Monday, 9 p.m. If you missed this episode, you can actually, the previous episode you've missed, you can watch them there. And on every Thursday, 9 a.m. Please also go to our Your Health Matters page on Facebook, join us on the platform. You can ask any question even after the program. The doctor will be happy to answer you. So Dr. Ajileye, when we say forensic, what do we mean? What does that mean for somebody who actually is not in the medical world, or somebody who is actually just a normal individual in the community? What do we mean by forensic?
Okay, for forensic, obviously, it's something that's quite commonly mentioned and people don't really know what it's all about. Generally, it's the interface between, the law and the application of science, particularly in this context, medical science, with criminal and legal, criminal and civil law. That's an interface between the science of medicine, the application of medicine in legal matters to help to solve problems. And in doing that, you work with different types of people within the criminal justice system, from the time in which somebody comes in contact for the first time with the criminal justice system, all through the process in the criminal justice system, the forensic activities happen. And that includes a lot of roles. Perhaps, for example, it includes collecting evidence, documenting evidence, and also explaining and interpreting evidence to the police, to the court, to the judge, in order to aid the administration of law and to aid the administration of criminal investigations. So it's a wide area, but generally the term and the word forensic comes from from a Latin word called forensis. And forensis is like something being in the public domain, having a public discussion. Now, when you now merge it with science, then it becomes forensics. So when you talk about forensic science, we're looking at detailed investigation in the court of law, for example, within the criminal justice system, looking at crime and applying systematic scientific model of investigation, evidential collections to support the administration of justice. So different people tend to work in this kind of field. So you would have seen in, crime scenes, you have forensic, science, sort of painting things and taking evidence and lifting DNAs. So that is one aspect of their work. That's also the clinical forensic medicine, where I come in, whereby I apply my medical knowledge to help the police in the investigation and in the preparation and the detention and treatment, of somebody who has come in contact with the criminal justice system. And that is basically working on a living subject. Whereas some other aspect of forensic, scientists also work on a dead, person, because obviously, as we know, in administration of justice, sometimes you may have to collect evidence from somebody who is not here with us anymore. And then you can have people who are forensic pathologists, to help in that field. And also for people who have developed other, difficulties like, mental health problems, you can have people working as a forensic psychiatrist, looking into their case and helping the court and the criminal justice system in the administration and in the clarification of the situation relating to that crime. And also, forensic involves injury documentations, evidential collections, in serious crimes like rape, like murder. And we have found forensic, scientists and medical examiners and physicians also working in inquest situation when there's an inquest on a particular, subject matter. And also, they can also provide expert witnesses advice and, professional advice in court, to explain and clarify for the judge some key issues relating to medical, matters, in order to help the administration of justice. So you can see it's such a very wide, subject. So that's what.
Yeah, it's actually, I can see. So you mentioned something, Ajileye. So you said actually, you actually come in to support the police. So for instance, if I actually go and actually get myself in trouble and I get arrested by the police, at what point do you come in?
Okay, well, for the forensic physician, I'm talking in respect of a doctor now, or a healthcare professional, okay? From the point at which a person is arrested by the police, okay, into custody, or they are detained, a doctor, a healthcare professional can come in at that point. And as a matter of fact, that is provided for under the Police and Criminal Evidence Act, Code C, subsection 9.5 to 9.14, which states that everybody that comes into contact with the police who would need medical intervention should not be denied the opportunity to see a medical professional, either because they have injuries or they are, subject to drug and alcohol problems, or maybe they have mental health disorder, or maybe they have some underlying medical condition. So at that very point, when they're arrested off the street and they're taken to police custody for whatever crime, a healthcare professional, a forensic physician can come into that picture from that point.
Okay, let me rephrase the question. How will you even know if the person has mental health issue to start with?
Okay, I mean, there's so many ways of knowing. I think the first thing is, when somebody is picked up by the police for an alleged crime, they're taken into police custody. At that time, they're not convicted. Or they might not have been, responsible for that alleged crime, but they will be taken for questioning, for interrogation. So during the process, the police, if they notice there is a change in the person's behavior, or they are presenting with what they suspect might be due to mental health problem, they can invite the forensic doctor to come into that situation, to come and give an assessment. And it is very important, because when you're going to question somebody for a crime, you see, there is a legal procedure that has to be followed. The person must be fit to be interviewed. Number one, the person also must be fit to be detained, because there's no point bringing somebody into custody when they're not fit to be detained.
Let's break it down. When you say fit, what do you mean?
Well, fit to be detained means that at the point that you're bringing them into custody, they are of sound mind, they are physically well, they're not suffering under the influence of any ongoing medical problem, they're not hypoglycemic, for example, they're not having, heart attack, for example, they're not psychotic at that point. So you have to assess, they're not bleeding profusely, maybe because they've been bruised and battered in the process of arrest. So you have to establish that this person is fit to be kept in custody, because the key thing is that police do not want death in custody, and nobody wants anybody to die under their care. And that is why the Police and Criminal Evidence Act, stipulates how anyone who comes in contact with the criminal justice system from the beginning needs to be treated. So if somebody is not fit to be detained, okay, it is the assessment of the forensic physician to advise the police about that, and then advise them appropriately what needs to happen. If they need to go to hospital from there, then they will be taken out of hospital. And then you have to advise the police, how do you want them to be taken? Do you want them to be taken on an emergency using a 999, or do you want them to be conveyed to the hospital by the police? So you have to determine and make a judgment on the urgency of the matter and advise the police. Now, if they are fit to be detained, obviously, you will have to advise the police that this person is fit to be detained. Then fit to be detained doesn't mean they're fit to be interviewed, okay? Because you want to interview somebody and you want to ensure that the evidence that you obtain, from them is admissible in court. Because if you do not appropriately, obtain the evidence in a proper way, then the case might not fly when it gets to court. Obviously, anyone that comes into contact with the criminal justice system will have access to legal representation. So you have somebody defending them. So apart from you alleging them, the police alleging that they've committed a crime, there's somebody who wants to make them free. So you have to ensure that the evidence you're collecting is admissible in court. And that part of the evidence means that you have to advise that they are fit to be interviewed. And they're fit to be charged as well, because if somebody is not fit to be charged of their crime, then how are they going to understand why they're being brought into custody, why they've come in contact with the criminal justice system in the first place? So at that point, the clinical forensic physician will be involved and helping the police. Now, if this individual is presenting what suspected to be a mental health problem, also the forensic physician then can make an assessment and advise the police appropriately and say, well, this person seemed to have what seemed to be a mental health issue, and therefore they need an assessment, for their mental health problem, or perhaps a treatment. And then you can either, in that situation, advise that this person needs to be diverted off the custody and be taken into hospital. Now, whether they're taken into hospital voluntarily or they're taken into hospital under the section of the mental health, that will be determined by the assessment and how they're presenting. So the forensic physician can advise the police that, okay, this person has got an underlying mental health problem or previous mental health diagnosis, they need treatment. They're not fit to be detained. They're not fit to be charged. They're not fit to be interviewed. They need hospital treatment for their mental health. And from there, they can be taken out of custody and then be taken into hospital for treatment for their mental health. So the provision is there.
So the provision that's actually been established. So there is, so does it mean that if I have mental health, so before we go on, I'm going to open the line. Please feel free to call and ask your question, because I realize most of the time, even when the doctor has said something, people still come and repeat the same thing. So the number is open. You can start calling in to speak to Dr. Ajileye, to ask any question in terms of the mental health support and the forensic. So if you have mental health issue and you actually get yourself involved in the criminal thing, so do we have support? Please call in. The number to call in is 079-353-18757. Can I have one of the admin, please, to put it on the Facebook platform, please? I repeat the number again, 079-353-18757. So you can call in and now to actually ask your question. So my question, Dr. Ajileye, is that, does it mean if I have a mental health problem, it's okay? If I commit a crime, I'll get away with it? Is that?
No. You necessarily do not have to get away with crime. Obviously, you know, the law does not want to punish somebody, you know, unnecessarily if they are not culpable. Okay, now, if somebody is alleged to have committed a crime, depending on the severity of the crime and the type of crime, let's say, for example, somebody has been alleged to have committed murder, okay, and they're brought into custody. And at the time they're brought to custody initially by the police, that is pre, you know, trial. They've not even been gone to court, so they're still within the police, custody, having investigation. The law allows police to investigate them and keep them in custody and charge them to court. Now, if they are exhibiting mental health problem at the time, that is within the police custody and within the criminal justice system, since the Bradley, report, the introduction of police and custody and court liaison and diversion services. So those ones will be able to liaise with the appropriate mental health in the community and arrange for them to be assessed, perhaps under the Mental Health Act. And then if at that time, they're not well, they will be taken into psychiatric hospital straight for treatment. So the police can bill them, they'll be taken under the section of the Mental Health Act for treatment. And obviously, depending on the risk, the type of ward they will be put into will depend on what is going on. So obviously they will be restricted, they will be kept in hospital for treatment. Now, when they become well, they can then be rearrested again and be taken back to police custody, when they can now be charged appropriately and perhaps be investigated and interviewed for the crime. But while all that is happening, it doesn't stop the police from investigating, the matter. They carry on their investigation in the background. It's just that they want the person to be mentally stable and well. And once they're well, they will have to face justice. So you cannot use, the excuse of mental illness or disorder to escape justice. There's no way you can do that. One way or the other, you have to pay for your crime. Now, having said that, there are some situations where people obviously can use the fact that they have disorder, to negotiate the punishment they will get. For example, that would be when they're now before the judge during the trial stage. This time they moved out of the police custody, they've been charged to court before the judge, and then they are being tried for this crime. Now, during that period, if they, for one reason or another, seem to present with what may be a mental disorder of some sort, the judge then, can remand them in hospital, under section 37 and put a restriction on them for treatment. And the restriction order is section 41 of the Mental Health Act. So they will use the forensic, part of the mental health law to put them in hospital And then once they get into hospital, then it will be the job of the forensic psychiatrist, to treat them, okay, and then advise the judge as to when they will be fit to obviously face trial, because they have to be fit to plead, either plead guilty or not plead not guilty, according to McNaughton rules. So there are procedures, that needs to happen. So whatever crime anyone has committed, the justice system has a way of administering, all these things. So whether you're well or unwell, the law caters for everyone, and is meant to be able to support anyone who is going through the criminal justice system, so that justice is well served. So people can have a mental disorder and then not go into prison, and then the judge can make an order under section 37, 41, and restricted to hospital for treatment. Now, how long they stay in hospital, varies. It depends on, obviously a specification under the specific mental health law. For example, section 37 allows them to be kept in hospital for initial period of 6 months for treatment for their mental disorder. And during that treatment, they would have to take treatment. They have no option. The treatment will be forced on them. And then there are restrictions that will be placed on their movement. And if they have to leave the hospital, it has to be agreed with the Ministry of Justice. Okay, there are mental health case workers in the Ministry of Justice who will receive reports periodically from their forensic psychiatrists advising the judge about their mental wellness. And then when they're well enough, they can be taken back to the court and then to face trial. Now, people can use mental disorder as a criminal defense. There are different ways of defending oneself and different ways, excuses a defense can use. One of them is insanity. So people actually can plead that they are insane while they committed a particular type of crime. And for example, if they commit murder, and if they are found to be mentally unwell at the time they commit the murder, it can actually change, the conviction of murder to a manslaughter, for example. So they can use that to negotiate, the type of punishment. Obviously, the punishment you will get for, a crime of murder is different from the punishment you will get for a crime of manslaughter, or a punishment you will get for grievous bodily harm due to provocation or anything like that will be different if it was done, when you have no control of your faculty, when you have a disease of the mind. And these areas are the areas where the forensic psychiatrist will be able to advise the court and advise the judge appropriately about the person's mental state, and also about their risk also. Because in this situation, we're looking at public safety also. And that is why there's a restriction order when they go into a secure hospital. And when the judge makes a pronouncement of section 37, for somebody to go into a hospital, which is called the hospital order, then it will be determined what type of hospital, kind of hospital setting they will go. There are 3 categories of secure, mental health facilities in the United Kingdom. We have the high secure, we have the medium secure, and the low secure one. Obviously, the high secure, there are just 3 of them in the United Kingdom. I think Broadmoor is one of them. Roehampton is one of them, and Ainsworth is one of them. So obviously those are for serious criminals, and people are likely to be, cause some problem for the public in terms of risk. Yeah.
Hello, welcome on Earth Matters program.
Good evening. Thank you for the announcement. I've got a question.
Please go ahead.
My question is there a difference between the terms criminal insanity and mental illness? Because sometimes they get mixed up together.
Okay. Did you get that, Dr. Ajileye?
If I get it right, so is there a difference between mental insanity and mental illness?
Criminal insanity and
Mental illness.
mental illness.
No, there's nothing like criminal insanity. You see, people can use, insanity as a defense against a particular crime, usually serious crime. Okay, and it means that the person has a defective mind or disease of the mind. Okay, and they have to be proven. And the only person who can prove that, okay, is a forensic psychiatrist by assessing this patient and drawing out a report, and advising the court. So if it is proven that this person has got a mental disorder of a nature and degree that warrants that, them being treated in hospital, then they can be deemed to be insane at the time they commit the crime. Okay, so it means that they're still criminals, but it's just that they are mentally disordered offender. Okay, they are offenders, but they're mentally disordered offender. So in that situation, if their condition requires treatment, the judge, okay, will make a hospital order for them to be taken to the hospital in a secure setting for treatment. Okay, so they are criminals, okay, but the fact is that they are mentally disordered. Now, that can happen at the pre-conviction stage, and also it can happen at post-conviction stage. It may well be that a person may go through the criminal justice system process, and they're tried and they're convicted of their crime. And at that point, the judge may decide that, well, they have to be sentenced to prison. Now, they may just go to prison, and while they are in prison, they begin to develop mental health problem. Because obviously prison environment is a different.
I was just, Dr. Ajileye, I was just reading the text the caller sent in that she meant that people who hasn't got mental health, but as a result of them being put in the prison and they develop mental health issue.
Okay, that's fine. Okay, that's clear now. So if somebody is in prison, okay, there is you can still get access to mental health services and treatment while in prison. And it's quite common. The majority of people in the prison population have mental health problems, okay? And it may be the first presentation, it may be that is a recurrence of the problem they've got before. Now, if somebody develop a mental disorder while in prison and they need treatment, they will be assessed first and foremost by the prison psychiatrist. Okay, there are facilities for enrich, for example, I'm a visiting consultant to one of the prisons. Okay,
so in a nutshell, every prison has psychiatrists allocated to them.
They have access to psychiatrists, and they have a multidisciplinary team of psychiatric nurses, okay, and psychologists, and everything you will find within the community in a non-secure setting. In a general population, you find there are services like that also within the prison population. So if somebody is convicted for any crime and they're sentenced to prison and they develop, mental health disorder, now if they need treatment in prison, they can be treated by the enriched psychiatrist and the mental health services there. Now, if the disorder is such that they need hospital admission, okay, now what would happen now is that it's the Ministry of Justice that will now use section 4749 to transfer, which is called, like a transfer direction, to move the patient or to move the prisoner or the offender from prison to a hospital in the community. Now, obviously, they're going to be transferred to a medium or high or low secure, depending on the nature of their crime. Okay, so people can develop mental health problem in prison, and then they still have access to hospital treatment, but they will be going to hospital under the transfer direction of section 47 and restriction order of 49. That means that even the psychiatrist in the hospital has no power to release them. Okay, it's only the Ministry of Justice that has the power, although the psychiatrists will have to do reports on regular basis to the Ministry of Justice, to the caseworkers, advising them on the progress of this patient. Now, if during the time they are in the hospital, they've served their terms of prison, then it will now be decided whether, they need a community mental health or they need to stay on there. Okay, or if they haven't served their sentence, they can also be sent back to prison to continue their sentences. Some people have long sentences.
Let's pick this call, Dr. Ajileye. Hello, welcome on Earth Matters program.
Hello.
You're welcome on Earth Matters.
I have a question for her.
Go ahead, please.
Yeah. What is the difference between forensic psychology
Forensic psychology
and a forensic psychiatrist?
psychiatrists. Okay. Did you get that? Of
What's the
course.
difference between a forensic psychologist and a
Yeah.
forensic psychiatrist?
Okay.
Obviously,
Yeah.
we both work within the criminal justice system, helping the police, the solicitors, and the court, in looking after people with mental health problems within the criminal justice system. Obviously, the psychologists, approach use different, therapy options, to do that. Whereas the psychiatrist is a doctor who uses mainly medical models and treating, mental health disorder with medications and a whole range of other interventions, for patients. So psychologists, work in tandem, with the psychiatrists and the nurses in managing patients with different mental health disorders.
All right, thank you. So just to add to what Dr. Ajileye said earlier on, psychiatric actually, like you rightly said, is a doctor, but a psychology actually is the people that give therapeutic intervention. The last program we did, I have a psychologist, but she's actually not in the forensic setting. So like Dr. Ajileye rightly said, that all the services and the support every individual, every one of us have in the community, we've been told that all the people in the prison also, they are entitled and they have access to them. So thank you so much for that. So what is the statistic, Dr. Ajileye, with people in the forensic setting that they have mental health issue as a result of their criminal issue? Is there any statistic, maybe due to anger, or is there any statistics?
Well, it's difficult to break it down because mainly people, get into criminal justice system for different reasons, okay? If you look at the prison population, those are the people who have been through trial and they've been convicted by the judge and they've been sent to prison. There is a large percentage of, them having mental issues or developing first episodes of mental health problem while in prison. And that is because prison environment is a very stressful environment. As we know, stress vulnerability, model indicates that, when people are overstressed, they're likely to break down. And some of these people already have their own innate vulnerability. And you have to bear in mind also all the kind of things that goes on in prison. There's anger, there's use of drugs also in prison. So people also, can be exposed to, illicit substances which are psychostimulants, which can trigger, mental health problem in prison. So quite a lot of, about 90% of the population in prison, have mental health disorder. And out of the 90%, you have 60% of them also have personality disorder of some sort. And then a lot of them have comorbid, substance misuse problem also. So in prison population, you have people with dual diagnosis of a psychotic illness and also, abuse of substances. And you see, the statistic varies between male and female. As a matter of fact, women are more vulnerable, to developing mental health problems, while in prison. And we have a larger percentage of them developing depression, while in prison, for obvious reasons. There's overcrowding in some prison setting, and in some prison setting, because people are isolated most of the time, these are all risk factors to the development of mental health problem. So in a large percentage of people, who are in the forensic setting have, a mental problem of one type of the other. And there are access to different, levels of care, okay, which has been commissioned by the NHS England to ensure that whoever is involved with the criminal justice system are not exempted. So there is a principle of equivalence of care. So the type of care somebody in the general population outside will get, for their mental health problem is also available for anyone who gets involved in the criminal justice system at every level, and the developmental problem, and they would have access to that type of care. For example, it is a multidisciplinary environment. Now, the aim of the criminal justice system is to make sure that people don't, stay too long in the criminal justice system or in that kind of setting, or even within the mental health system. So that is why the custody and court and diversion liaison services was created. So people can actually commit a crime, but if they have existing mental health problem, they can be diverted away from the court. And then, because obviously, somebody who's already, compromised with his mental health, and sending them to prison, is going to, sort of, complicate their problem. So it depends on the type of crime, I have to say. But obviously, if it's such that the crime doesn't mean that they are a risk to the public, then they can be diverted away from there, and then into the, community mental health services. And then they can see, community psychiatrists, they can have access to treatment, they can have follow-ups in the community. And of course, obviously, they won't, they can get, so diverted away from that system. But if the crime is so severe, like rape, for example, or murder, for example, or serious fraud or terrorism, for example, that they would have to go to prison for a very long time. And then obviously they are vulnerable. Okay, so there's overrepresentation, I have to say, of the Black and ethnic minority in prison population. And this is because obviously we have all our vulnerabilities from the beginning. And of course, the system as well, has been deemed to be institutionally racist. And this is as a result of the statistic brought out by the Institute of Race Relations. So we have a preponderance and overrepresentation of Black and ethnic minority in prison population, about 60% of them, compared to the white population, the Caucasian population. And obviously, in that situation, a lot of them have their own existing vulnerability, and they use the mental health services quite a lot in prison for their own problem. So the statistics are available there.
Hold on a minute. Let's explain a little bit about what you just said. So are you saying to me, if those people, the Black minorities in the prison that has existing mental health issue, are you saying they were not being, is it not the same law? Is it not the same judgment that the white people get? I don't understand.
No.
What's that?
Because of the way this, you see, somebody in the Black and ethnic minority are more likely, to be arrested by the police for the crime they've committed. They are more likely to, be presented to the court for trial, compared to the other ethnic group, and therefore they're more likely to have been exposed to the use of drugs and alcohol. They're more likely to have come from a deprived background, so they already have this, sort of risk factors that make them, vulnerable to committing crime. And of course, in committing crime, they get into the criminal justice system even much earlier in life. So the age at which they come in contact with the criminal justice is younger. And also, obviously, because of the weaknesses in the system, they are more likely to get longer sentences, and they are more likely to be convicted for their crime. Okay, so therefore, the population in the prison population, is overrepresented, and this are evidence of fact. Okay, and this is available, in the by the Home Office National Statistics, is available from the Department of Health Statistics. When you also check the offender statistics, you will see there. When you check the probation and prison statistics, you will see that there's overrepresentation of Black and ethnic minority for the reasons I've explained to you. But the fact is that when they get into prison, obviously, they do have access to equal level of mental health care and support, that anyone would get in that set. It's just that their population, they are more, in number, in the prison population using mental health services than the other, ethnic background.
All right, thank you so much. You also mentioned earlier on that when people are actually in the prison, they are actually they develop risk of drug and alcohol. Should they have access to drug in prison? Because Dr. Ajileye, I remember when I used to work on the ward in the acute setting, even in the acute, not PQ. PQ is more actually secure than acute. Yeah. When they go out, maybe on leave, or maybe to visit lunch or whatever, or maybe when they're coming back after their this thing, we scan them.
Yeah.
We scan them to ensure they're not nobody's bringing any illegal thing. So how do they have access to drug in prison?
Well, obviously my role there is clinical. I'm a doctor. To be honest, you know, if you hear ingenious ways in which these people have access to drugs in prison, you'll be surprised. Yeah, the different ways, you know, I mean, you've heard of, you know, birds, you know, delivering drugs to people. Drone have been known in some prison to have delivered drugs to people. People who visit, you know, them in prison can bring, you know, drugs. And sometimes, you know, some members of staff also have been, you know, accused of, you know, supplying drugs. So there is quite a lot of, you know, business going on, you know, in prison, and they have access to different types of drugs. And some of these people also can make, you know, some, you know, substances themselves. You'll be surprised what they use. I've heard people using their urine, you know, mixed with several other things, or fermenting their food, you know, to be able to create something that will be psychostimulating for them in prison. So it's not only that they have access to cocaine or heroin and all those things, cannabis, amphetamine, they can also make something, you know, that they can sniff themselves. And some of these things have, you know, effect on their brain and on their mental health. So yes, there are, you know, preponderance and availability of drugs of different types in prison. They hide it, you know, some of them go on maybe a conditional discharge or community visit, and they bring some of these things in different ways. And how they do it, I don't know, because obviously that's not my own area. That's for the prison governor to be able to, you know, advise on that.
Thank you so much. So you've actually talked about the support within the criminal justice, and you mentioned earlier on that you had two roles. I want you to kind of come back to it. You said you have two roles, like as a psychiatric to the, I missed that bit. Can you please?
Yeah. I work as a psychiatrist, clinical psychiatrist in the NHS. Okay, so I'm trained as a general adult psychiatrist. So I treat people, you know, in the community who have developmental disorder. So I do apply, you know, the civil aspect of the mental health, you know, act in treating people either by sectioning them in hospital or voluntarily. Okay, so that's one role. And when I put on the cap of a forensic physician or a prison psychiatrist, sometimes I have to use, you know, the forensic, you know, mental health law also to apply to treat people who have been in the interface between the criminal justice system and mental health services. So I provide, you know, my services there. So we have to be clear that, you know, a clinical forensic physician, okay, you know, it's not, it doesn't have to be a psychiatrist, okay? It's just, I happen to be a psychiatrist, so I have an additional skills to bring to the table. So generally, a clinical forensic physician can be any medically qualified person who have advanced training in forensic medicine, in road traffic medicine, or sexual offense medicine, or medical legal. And I happen to be trained in that as well. So when I go into the police custody, okay, I don't have to be involved as a psychiatrist. I can just provide my services, you know, in helping them during a road traffic, you know, offense when somebody is arrested for suspected drink driving, to provide, you know, to obtain the evidence from them, or also to do impairment tests. So I'm working there as a forensic physician. If somebody is arrested for alleged rape, for example, I can provide, you know, sexual offense, you know, medicine there by for the perpetrator and alleged perpetrator, and also to the victim, in obtaining, according to legal standard and procedure, the evidential DNA that is required for the perpetrator and also for the victim. So in that role, I'm not working as a psychiatrist. Okay, now my psychiatric role comes into play if, for example, I have somebody, a detainee or a suspect in custody who is manifesting what's suspected to be an acute behavioral disturbances. Obviously, I don't need to call a psychiatrist from outside there to come and help. I can now put in the cap of the psychiatrist and treat the patient, or advise the police how they will manage this kind of disturbed behavior. So that's an additional advantage that I do have. And sometimes some of my colleagues will consult me, you know, on this matter or how to deal with this kind of issue. And also I have access to, the multidisciplinary team of other mental health services in the community that can call upon to come and help me there. So it can actually, speed up the process, of detention of that patient while in custody. And also decisions can be given to the police quickly, and appropriate advice can be given to the police quickly, when I'm in that role, because I can function in both ways. Now, that is in custody. Yeah.
Just before we proceed, the number again to call is 079 353 18757. Before we actually wrap up, is there any support for younger people that actually have mental health issue and actually commit crime? Is there any support for them?
Oh, absolutely. As I said, there is a principle of equivalence of care. Even the younger people, in the United Kingdom, the age of criminal responsibility is 10.
10.
Yeah.
But let's make it very clear. So when a 10-year-old child commits crime,
yes,
you're saying the child will face the law?
They will face the law. Now, part of the assessment of the clinical forensic physician is also to advise the police on the use of appropriate adult, okay, when they are questioning this 10-year-old person, okay, or somebody who has learning disability, or somebody who has some neurodevelopmental disorder. Okay, so if a 10-year-old person has committed crime, we do see them sadly from time to time when these youngsters, 14-year-old, have stabbed somebody or stabbed their friends or shot them in the head, all these things, they come into custody. Obviously, they will need an appropriate adult, and who serves an appropriate adult, is prescribed for by the law. Most of the time is their parents. And sometimes if they don't have a responsible adult, it could just be it can be a social worker, for example, or they can draw an appropriate adult for them from the appropriate adult network to come and be present with them. Their role is just to be present while this person is carefully interviewed. Because as I said to you, the way the solicitors or the detectives obtain evidence, is very important. So evidence cannot be obtained under duress, okay? There is a legal standard in which they have to abide by to obtain this evidence from this 10-year-old. There's a way they have to interview them to ensure that that evidence is admissible before court. So they will be, interviewed, they will be tried, they can present them to the judge if they have a mental health problem, okay? For example, let's say somebody who is younger than 10, less than age of criminal responsibility, has committed a crime. Obviously, they can get away with it because they are deemed to be infant. I think the law in this jurisdiction, allows that somebody who is an infant, so which is a criminal defense, okay? They can, they can actually not, be tried and go to prison. They maybe be diverted to the youth offender, services or other kind of services will help them. But once you reach the age of criminal responsibility, the criminal justice system and the process of obtaining evidence will have to follow its due course. And then they may be, presented to the judge, and then they will be tried. If they now have a mental disorder, then the defense or the punishment can be modified, by by diminished responsibility using the McNaughton's rule, and also they can be deemed to have committed a crime because of insanity, and therefore, obviously, they will need treatment in hospital rather than go to prison. So this is how it's worked out, really. And there are youth offenders prisons, okay? There are prisons for younger people, and this can be quite traumatizing for them, because you see, a lot of these people will go to prison, and when they are transiting from prison service, because they have been institutionalized for a very long time into the community, is always very, very difficult. So you find that they can easily reoffend. So the rate of reoffending is quite high because these people have been traumatized. So the role of the law is to ensure that these people are diverted away from prison, community, if they can avoid it. If they cannot avoid it, then the services will have to provide extensive rehabilitation intervention for them. So even if they've served their sentence, they may not be released into the community, maybe because they're still deemed to be unsafe, or being a public risk. Then they will have to go through rehabilitation process. And that is an entire different team entirely who would help in rehabilitating them before they can obviously become member of the community or general population again. So there are services for different range of different people, with different mental health problem within the United Kingdom jurisdiction. I think there are commissioners who have commissioned secure services for people who have come in contact with criminal justice system and also the mental health system. So the services are there, and the support is there for them. Also for their families also. So it's not just for the offenders. Also their family do suffer a lot from the effect of their crime. So there are services also that are provided for the families of the offenders, okay, because obviously of the separation or the isolation and for so many other reasons, a lot of them also can prestate, some difficulty in their mental health problem, and they will need support as well. So the services is quite integrated in the United Kingdom, and it is provided for. And the aim of everything is to ensure that whoever is within the criminal justice system does not suffer. There is a principle of equivalence of care. Whoever is within the criminal justice system does not die, because for a death in custody, either in prison or in police custody, is a very serious situation, and there is a significant investigation, and we've had several inquiries. For example, David Bennett inquiry. David Bennett was a mentally disordered patient who had schizophrenia, who died, in prison custody, and that led to a serious inquiries, and which led to a lot of policy changes about how people within the prison services are treated when they have mental health problem. We've had Christopher Clooney's inquiries, okay, we've had, Owen Blackwood, so we have Stephen Lawrence. So all these kind of inquiries are important. And when people die in custody of the criminal justice system, it triggers a lot of policy changes. And then, of course, that can lead to improvement in the services we provide, and we learn lessons from them. And the UK is quite good in ensuring that, whatever recommendation is made by the panel of inquiries are implemented to the core. If it requires training for staff members, if it requires, updating the services or the facilities, they will do that. And the funding for the services are always very available, because as I said, the aim is that nobody should suffer because of their mental health.
Thank you so much. That was actually very educative. Thank you so much. I think we've learned quite a lot. I want to say thank you so much to Dr. Ajileye. Based on the fact that I live back in Dagenham, so in Dagenham to be precise, actually, recent incidents has actually happened that we had some people actually killed one another, and as a result of domestic violence. Before we wrap up, because we are rounding up now. So before we actually end this program, I want to appreciate Dr. Ajileye to start with. Thank you so much for your support today. We really appreciate your support. I really appreciate taking your time to educate people and enlighten people to say, you know what, the fact that you have criminal issue doesn't mean your mental health issue will be forgotten. There is support out there, even within the prison system. Thank you so much for that. And I hope to have you more on different topics soon. So before we actually go on today's Health Matters program, I'm using this medium to appreciate all the viewers on the Facebook. Please, if you have any question, and obviously it's a very sensitive issue and topic, put your comments on the Facebook. If you, because of confidentiality, you can send your questions to info.healthmatters@yahoo.com. We will reply you. I'll forward the information to Dr. Ajileye, and he has actually promised to respond to any question on the Facebook, any question on the email, and obviously people, like I said, people don't have to know your business. That's what I was saying earlier on, because of the issue that happened in Dagenham recently about domestic violence. So we will be looking at domestic violence next month. On this issue, we'll be actually, I've actually been in touch with the council, Bucking and Dagenham Council, and the domestic violence, people in charge of domestic violence will be coming on the show next month.
Okay.
And before we wrap up this show, we're going to look at it from different angle this time, because domestic violence. It's a shame that those people died, because it's not a do or die matter. Marriage shouldn't be a do or die matter. If you're